Assalamualaikum. Today the topic, the lecture is the water soluble vitamins, and we are going to discuss about the water soluble vitamin B9 or folic acid. Actually, the folic acid is obtained from the green leafy vegetables, and its name reflects foliage, derived from the Latin word folium, meaning leaf, serve as a carrier of one carbon unit during the several biosynthetic process. Two other cofactors are also known to be involved in the addition of the one carbon unit to the metabolic precursor, that is the biotin in the oxidation reaction, and acetylmethylmethionine as a ethylating agent. However, the folic acid is more versatile than either of these two because it can transfer the one carbon units in several oxidation states. The sources of the folic acids are the liver, yeast, and spinach are the rich sources of the folic acid. The other dietary sources of folic acid are dairy products, seafood, nuts, beans, and green vegetables. RDA of folic acid is approximately 200 microgram. Absorption, distribution of the folic acid. Folic acid is absorbed in the jejunum, in intestinal lumen, all but once the glutamyl residues are removed by the hydrolysis prior to the absorption. This is achieved by the 2-gamma-glutamyl hydrolysis. The absorption following the folic acid is transported in the blood by the 2-beta globins. The major circulating form is the methyl tetrahydrofolate, and the normal concentration range is 5 to 15 nanogram per ml. Once it reaches in the liver, the methyl derivatives are taken up by the hepatocytes, where the various coenzyme forms are produced. Folic acid is not stored in the tissues. Next is the structure of the folic acid. Folic acid consists of the three components, that is the pteridine ring, linked in the sequence to the para-aminobenzoic acid. The pteridine ring and the para-aminobenzoic acid is called as the uric acid, which is linked with the glutamic acid, and this whole structure is called as the folic acid or terryl glutamic acid, the other name of the folic acid. Next, how the synthesis of the folic acid takes place. The pteridine and the para-aminobenzoic acid are linked covalently by the terryl synthetase to form the uric acid. Later is attached to the glutamic residue to form the folic acid. A polyglutamate tail is filled by the addition of the more glutamyl residues, which imparts multiple negative charges to the molecule, and so it cannot traverse biological membrane by passive diffusion. Thus, polyglutamylation serves to sequester folate in the cells in which it is required. However, mammals cannot synthesize folic acid, so it must be provided in the diet or by the intestinal microorganism. Many microorganisms can synthesize their own folate as long as PABA is present, or you can say para-aminobenzoic acid is present in the medium. Therefore, PABA, the active form or the coenzyme form of the folic acid, or you can say how the activation of the folic acid takes place. Folate in the human organism must be doubly reduced to become an active coenzyme form, that is called as the tetrahydrofolic acid or terryl glutamate. The reduction takes place in the stepwise. The folate is converted into the dihydrofolate by the dihydrofolate reductase enzyme, which is the H-dependent enzyme. Next, the dihydrofolate is converted into the tetrahydrofolate by the dihydrofolate reductase enzyme. Here is the structure of the coenzyme of the active form of the tetrahydrofolic acid. There are multiple forms of the folate present in the diet. The 7 additional glutamate residues linked by the gamma peptide bonds. In addition, the 1 carbon substituted folates are also may be present in the foods. The extent to which the different forms of folate can be absorbed varies, and folate intakes are calculated as a dietary folate equivalence, that is the sum of the microgram of the food folates plus 1.7 multiplied by microgram of the folic acid. It means used in the food enrichment. Here is the tetrahydrofolic acid and the 1 carbon substituted folates. 5 formyl tetrahydrofolate, 10 formyl tetrahydrofolate, 5 formamino tetrahydrofolate, 5 10 methyl tetrahydrofolate, 5 methyl tetrahydrofolate, 5 10 methynyl tetrahydrofolate. The coenzyme form or the active form of the folic acid is the tetrahydrofolic acid. The function of the tetrahydrofolic acid, as it is involved in the 1 carbon metabolism, and the 1 carbon metabolism, it accepts the 1 carbon unit, and here is the point of the attachment N5 and N10. The tetrahydrofolic acid receives the 1 carbon unit from the various donor molecules and can transfer them to the specific acceptors for the synthesis of the various compounds. However, the 1 carbon moiety are the methyl, methylene, methinyl, formyl and formamino, and these are derived from the various sources. However, these are the sources which are the donor of the 1 carbon unit, and they are accepted and transferred to the various biochemical reactions for the synthesis of the various compounds in the body. The tetrahydrofolate can carry 1 carbon fragments, and they attached in case of the formyl, formamino or methyl group, it is attached to the N5. In case of the formyl, it attached with the N10, while the methylene or the methyl groups are involved in the bridging of N5 and N10. The 5-formyl tetrahydrofolate is more stable than the folate and is therefore used pharmaceutically, known as the folinic acid, and its synthetic racemic compound is the leucovorin. Folinic acid used as a medicine to reduce the toxic effect of the methotrexate drug. The major point of entry for 1 carbon fragment into substituted folate is the methyl tetrahydrofolate, which is formed by the reaction of the glycine, serine and the choline with the tetrahydrofolate. Serine is the most important source of the substituted folates for the biosynthetic reaction, and the variety and the activities of the serine hydroxymethyl transferase is regulated by the state of folate substitution and the availability of the folate. The reaction is reversible, and in the liver it can form serine from glycine as a substrate for the gluconeogenesis. However, the methylene, methinyl and 10 formyl tetrahydrofolates are interconvertible. When one carbon folates are not required, the oxidation of formyl tetrahydrofolate to yield carbon dioxide provides a means of maintaining a pool of free folate. However, the function of the active form of the folic acid is involved in the one carbon metabolism. The one carbon metabolism, there are the various moieties of the one carbon as shown in the earlier slides, and they are derived from the various sources such as serine, glycine and the choline. It involves the point of entry in the one carbon metabolism is the methyl tetrahydrofolate. The methyl tetrahydrofolate is involved in the formation of the methylene tetrahydrofolate is involved in the formation of the methyl tetrahydrofolate, and while methylene tetrahydrofolate also involves in the formation of the thymidine monophosphate, which involves in the DNA synthesis. However, the formyl tetrahydrofolate is the important source for these carbon 2 and carbon 8 of the ring of the purine and involves in the purine synthesis. So you can say the folic acid is important precursor for the synthesis of the DNA, RNA and the nucleotide. However, this methylene tetrahydrofolate is converted into the methyl tetrahydrofolate. It is the irreversible reaction. However, this methyl tetrahydrofolate is also involved in the formation of the methionine from the homocysteine, and this reaction also requires the vitamin B12. Here is the reaction in which the methylene tetrahydrofolate is converted into the tetrahydrofolate. It is irreversible reaction. Here there is also the conversion of homocysteine to methionine with the help of the methylcobalamin vitamin in the presence of the enzyme methionine synthase. If there is a deficiency of the vitamin B12, therefore the conversion of the homocysteine to methionine is blocked, and the formation of tetrahydrofolate also takes place, and the folic acid in the form of the methylene tetrahydrofolate is trapped in this form. And however, when the homocysteine is not converted into the methionine, there is the high level of the homocysteine which results in the various cardiovascular diseases. Here is the summary of the one carbon metabolism, in which the various one carbon molecule, for example formyl, methylene, methanol, derived from the various sources, for example glycine, serine, histidine, and is transferred one carbon moiety to the tetrahydrofolic acid and transferred to the various biochemical reactions for the formation of the various compounds, for example synthesis of amino acid, purine, thymidine and choline. Inhibitors of the folate metabolism. The inhibitors of the folate metabolism provide cancer chemotherapy, antibacterial and anti-malarial drugs. The methylation of the deoxyuridine monophosphate to the thymidine monophosphate catalyzed by the thymidylate synthase is essential for the synthesis of the DNA. The one carbon fragment of methylene tetrahydrofolate is reduced to the methyl group with the release of the dihydrofolate, which is then reduced back to the tetrahydrofolate by the dihydrofolate reductase. Thymidylate synthase and dihydrofolate reductase are especially active in the tissues with the high rate of the cell division. However, the different drugs, trimethoprim, it is used as antibacterial drug. Trimethamine It is the antimalarial drugs, and methotrexate, which is used in the cancer chemotherapy. Methotrexate, it is an analog of the 10-methylene tetrahydrofolate, inhibits the dihydrofolate reductase and used in the cancer chemotherapy. Here is the diagrammatic representation where the drugs act as an inhibitor of the various enzymes. Here the sulfonamides competitively inhibit the synthesis of the folic acid in the microorganism, thereby decrease the synthesis of the nucleotides needed for the replication of the DNA. And here the methotrexate, it causes as an inhibitor, it is the inhibitor of the dihydrofolate reductase. Is its mechanism of action is competitive inhibition of folic acid analog used to treat the psoriasis, rheumatoid arthritis, and the neoplastic disease. Here is the mechanism of the conversion of formation of the active form of the folic acid, that is the tetrahydrofolic acid. This reaction takes place in the microorganism and acts in the human and microorganism. Also, pteridine precursor plus para-aminobenzoic acid in the help of the enzyme, with independence of the enzyme dihydropyruvic synthetase converted into the folic acid with the addition of the glutamate, and this folic acid is converted into the tetrahydrofolic acid with the help of the enzyme dihydrofolate reductase, and this tetrahydrofolic acid involves in the various biochemical reactions such as amino acid synthesis, protein synthesis, and the thymidine phosphate synthesis. However, the sulfonamides inhibit the dihydropyruvic synthetase, which inhibits the formation of the folic acid, while the methotrexate inhibits the dihydrofolate reductase, which inhibit the conversion of the folic acid into the tetrahydrofolic acid. Folate trap hypothesis. This is very important regarding the vitamin B9, and also you can say related with the vitamin B12. It is the interrelationship between the folic acid and the vitamin B12, folate trap or methyl trap hypothesis. The deficiency of either folate or vitamin B12 results in the similar type of the anemia. This suggests that the biochemical interrelation between these two vitamins. There is only one metabolic reaction known common to folate and vitamin B12 is the conversion of the homocysteine to methionine, while with the conversion of the methionine tetrahydrofolate to the tetrahydrofolate. In the vitamin B12 deficiency, increased folate levels are observed in the plasma. The activity of the enzyme homocysteine methyltransferase, or you can say the methionine synthase, is low in the B12 deficiency. As a result, the only major pathway for the conversion of N-methyl tetrahydrofolate to tetrahydrofolate is blocked, and the body tetrahydrofolate pool is reduced. Essentially, almost the entire body folate becomes trapped as the N-5-methyl tetrahydrofolate. This is known as the folate trap or the methyl trap. In this manner, vitamin B12 deficiency results in the decreased folate coenzyme that lead to the reduced nucleotide and DNA synthesis. However, the tissue's folate level are adequate or high. There is a functional folate deficiency due to the lack of the tetrahydrofolic acid pool. And this outcome is the development of the megaloblastic anemia. Next is the deficiency symptoms or manifestation of the folic acid. First is the megaloblastic anemia. The deficiency of folic acid itself, or deficiency of vitamin B12, which leads to the functional folic acid deficiency, affects these cells that are dividing rapidly because they have a large requirement for the thymidine for the DNA synthesis. Clinically, this is involves the bone marrow, leading to the megaloblastic anemia. Actually, in the megaloblastic anemia, there is inhibited synthesis of the thymidine monophosphate, therefore decrease or inhibited synthesis of the purine, and also the decrease or synthesis of the DNA and the RNA. Due to the inhibited or decreased synthesis of the DNA and the nucleic acid, cell division stopped in the S phase. Cell growth occurs without cell division, which needs to increase in the cytoplasm of the RBCs, then decrease in the size of the nucleus. Due to these factors, that is the increase in the size of the cytoplasm and decrease in the size of the nucleus of the RBCs, the RBCs appear megaloblast, that is the large cytoplasm in the RBCs as compared to the nucleus, that is decrease the size due to the decrease or inhibited nucleic acid. Next, we discuss about shortly the nutritional anemias. Nutritional anemia, as you know very well, anemia is a condition in which the blood has a lower than normal concentration of hemoglobin, which results in reduced ability to transport the oxygen. However, the nutritional anemia that is caused by the inadequate intake of one or more essential nutrients. They can be classified according to the size of the red blood cells, or you can say that the mean corpuscular volume MCV. The microcytic anemia is the microcytic anemia caused by the lack of the iron, is the most common form of the nutritional anemia, maybe due to the copper or pyroxene deficiency. The second major category of the nutritional anemia is the macrocytic anemia, in which the MCV above the normal results from the deficiency in the folic acid or vitamin B12. In the macrocytic anemia, they are commonly called megaloblastic because a deficiency of either vitamin or both causes accumulation of the large immature RBC precursor known as the megaloblast in the bone marrow and the blood. However, these are the normal marrow and these are the megaloblastic forms. Next, deficiency manifestation is the neural tube defect in form of the spina bifida and anencephaly. Both of these are the types of the neural tube defects. Basically, these are the birth defect when the spine and spinal cord don't form properly. When the neural tube fails to close at the base of the skull, also called the open skull, it is a birth defect in which the major part of the brain and the skull of fetus do not form completely. Therefore, all women of childbearing age are advised to consume 400 micrograms of folic acid to reduce the risk of having the pregnancy affected by the neural tube defect, and sometimes 10 times that amount if the previous pregnancy was affected. The next deficiency symptom is the homocystinemia. As we discussed earlier, that the homocysteine is converted into the methionine, but when there is a deficiency of the vitamin B12, then this conversion is blocked, so the level of the homocysteine raised, and it involves in the various cardiovascular diseases, and these are the risk factors of atherosclerosis, thrombosis, and the hypertension. There is also evidence shows that the low folate status results in the impaired methylation of the CpG island in the DNA, which is a factor in the development of the colorectal and other cancers. Folic acid enrichment of foods may put some people at risk. Folic acid supplements will rectify the dermoplastic anemia or vitamin B12 deficiency but not irreversible nerve damage. A high intake of folic acid can thus mask a vitamin B12 deficiency. However, antagonism between the folic acid and some used in the treatment of the epilepsy, there is some evidence that the folate supplements may increase the risk of the developing colorectal cancer, particularly among the people with the monoplastic colorectal polyps. It was all about the vitamin B9 or the folic acid, its active form, its involvement in the one carbon metabolism, its function in the body, its deficiency symptoms, especially the megaloblastic anemia and the folate trap hypothesis. Thanks.